Good morning, everyone. It's 10:30, and we'll get started with today's webinar. It's been a little while since we've been together for a Friday update, so thanks for coming back and joining us after a few weeks off. Just a couple of reminders. You are absolutely encouraged to submit questions during this webinar. If you'll please send those to all panelists, that would be most appreciated. And with that, I am going to turn it over to Dr. Stanislaus.
Good morning, everybody. Thanks for attending the webinar. Since we last met, we've had a new COVID variant that has been making its rounds in the world. And we did find out that at least we have one confirmed case in Missouri. So I know the Omicron variant has been in everybody's mind. It has been dominating the news. So want to touch a little bit on that. So one thing I want to make sure that we understand is we know very little about this variant than anything else right now. So we have to, whatever we know at this point or whatever we think we know at this point can be proven wrong. All right. I want to really start that with that caveat saying that what we think we know can be proven wrong. The reason we think what we think we know is because it's based on some of the mutations that are seen in this particular variant. The mutations, especially in the spike protein, which is the spiky thing through which the virus attaches to our receptors in our body. That spiky thing, there has been about 30 mutations in that spiky thing, which is why they were specifically worried whether current vaccines may identify them or not, or current antibodies to the vaccines that you've taken, are they going to identify them or not? So there's a lot of things about that. So there was one concern that was raised. And then the other concern was because it was also found to be, it had also a lot of the kind of similarities to the Delta variant, some of the changes it made to the spike protein, and they thought it could be extremely much more infectious. What does that mean? It can actually spread from one person to another quicker, faster, and infect more people at a shorter period of time. So that is infectiousness. And they thought it could be much more infectious than the Delta or any other variant we know. So these are the two things. And the third thing is, how sick will it make people? That's an important question as well. You can get infected with it, but that doesn't mean you're going to be sick. So is the Omicron variant going to make us more sick than any of the previous variants? And these are the three questions we need to answer. So let's start with the first one. How infectious is Omicron? There's a lot more data coming out of UK, South Africa, and even other places saying it does transmit much faster. The current prediction is that between January and May of next year, Omicron variant could be the predominant variant in most of the world. So because they believe that the way it is spreading, it really spreads faster from person to person, and then it goes to multiple people. One person gets infected, it then spreads to multiple people, and so it can exponentially it can get infected. It can be infectious. So we do know that it does spread faster. It is much more infectious. Now, what does that mean? It means that a lot more people can get infected with it, but doesn't mean that they're going to get as sick. That's important to know. How sick can the person become after they get infected? So currently, the information that's coming out of UK and from South Africa is that they're typically much more milder. The symptoms are milder than what they've seen in even Delta or other of the COVID variants. That is what they think now. Now, again, there's not enough time. Typically, when you're looking at severity of illness, you're looking at hospital data and ICU data. We do not have hospital and ICU data as of now, but the preliminary information that is coming out of these countries shows that the symptoms could be much milder. But again, there's not enough time. Typically, the hospitalization data and ICU data does not come until about four weeks or more after there is a spread, after the variant changes have occurred. And we know that was somewhere in mid-November that this variant was even sequenced and identified. So, we'll have to wait a little bit more to really understand the impact of this variant on severity when it relates to hospitalizations and ICU, the use. The other thing is also the mild infection that have been reported is already on individuals who are younger, and many of them who've been vaccinated. So we do not know how it would react to individuals who are much more vulnerable, the elderly, or a congregate living environment setting, group homes, and who are also unvaccinated. We do not know what its effect would be on that particular population. Again, we need to wait for a few more weeks to know more about that. About vaccine escape. So, are the antibodies that our bodies have produced in response to the vaccines, are they enough to protect us from getting sick? Again, there are two things to remember when you have COVID. One, when you get infected with the virus. One is infectiousness. That means you have the virus in you. You get flu-like symptoms, your body ache. You have a sore throat, and you have, but you're not sick enough that you need to end up in the hospital. That is getting infected, but not seriously ill. And the vaccine, now the data clearly shows that the vaccines actually protect you from getting seriously ill. So when we look at that kind of, so the Pfizer recently did a research, I think it just was published yesterday, where they said that their 2 doses are not as protective for the Omicron variant. But if they did take the booster, the 3rd dosage, the protection was much better. Okay, again, I don't know the exact numbers, but they say it's much better. So based on this, the recommendation currently is anybody who's had 2 doses of an mRNA vaccines, and maybe like Pfizer or Moderna, taking the 3rd dose might produce enough antibodies to protect against serious side effects from the virus, even if the individual gets infected with the Omicron variant. There's no news on the J&J. So I think that is, if people have taken a J&J vaccine, then you have to talk to your doctor to figure out whether it might be worthwhile taking the Pfizer or Moderna as a booster dose. And the CDC does allow for that. So that's what we know so much about Omicron. What is important to know is there is much more we do not know. So we'll just have to wait and keep looking for as the data comes in, and we'll keep you updated. The other thing to remember is that no matter what the variant is, be it alpha, beta, gamma, delta, and now Omicron, our mitigation strategies do work. So what are the mitigation strategies we are talking about? It is masking, wearing a mask as close to your skin as possible, and making sure your nose and mouth is fully covered, and maintaining sufficient distance between 2 individuals, especially if you're standing face to face and talking, making sure you have enough space between you while you're communicating, and also preventing congregation in small closed spaces in the winter, because the ventilation plays a very important role. During winter, we do not get the outside air to come and dilute or take away the air that we breathe. So in small closed spaces, making sure there's enough space. I mean, a room size should determine how many people can safely fit in that room and mitigate, meaning that the risk of getting the virus can be less. So those are mitigation strategies that we need to think about carefully as we go into this holiday season. What has been happening in Missouri is that our rates have gone up, especially after Thanksgiving. Our rates are going up quite significantly, to the point that our hospitalization in Missouri from the Delta is at the peak where it was close to the July numbers. August numbers were pretty high. And the numbers that we are seeing, it's gone up again. It kind of went down in October and it's peaking up again. And this is the transmission that occurred mainly during the holiday season. So really be careful about when you're looking at coming weeks or months with the winter, closed spaces, and holiday season. Really looking at some of the mitigation strategies and still able to meet people. It's not to say cannot meet people. We got to live. So, but let's live with by mitigating and being responsible. That's all I have. Any other questions? Any questions you see, Heike? Does the AG's win in court have any effect on the use of masks by agencies? I can only speak for Department of Mental Health, because Department of Mental Health does take care of a very vulnerable residents and patients, both in our developmental disability facilities and in our state hospitals, and all our staff are 24/7. I mean, these are 24/7 facilities. There'll be no, we will continue for the protection of the staff and patients. We will be continuing mandatory masking for the foreseeable future.
And that's the only question that I have seen come in today.
All right, that's all I have. I'll hand it over to Dr. Trivedi.
Perfect.
Hi. Great, thank you. Can you hear me okay?
Yes.
Okay, great, thank you. I just need a minute or two to discuss our telehealth services and to remind people that we are there to support them. What is most important, and you may have heard this, and I apologize if you have, but we're really pleased to announce that through our partnership and continued partnership with Missouri Department of Mental Health Division of DD, our telehealth services are now available to any Missouri resident on a Medicaid waiver. So we've transitioned successfully through the great work of the division, our services to waiver services. And just to refresh your memory, we are physicians that are specially trained to treat this population, available 24 hours a day, 7 days a week, specifically to treat the needs of the IDD population. We address any non-life-threatening medical condition, any question, a specific question about COVID, again, as we're talking now about these new variants. And really only thing that needs to happen is you can continue calling us, but we are encouraging service coordinators to add this service, we think a valuable service, to an individual's ISP. If you have specific questions, you can contact me directly or Station MD, and I'll put our information in the chat box, or you can email us, and there's an email that I'll put in there. But most service coordinators are aware of it. The name of the specific waiver is called the Health Assessment Coordination Waiver, Health Assessment and Coordination Waiver. And again, it's really simple to add to an individual's support plan. I do want to emphasize again that we are available to serve as a resource to individuals, to family members, to agencies, DSPs, and I think that it's been an overwhelming success partnering with the state, and we've just simply transitioned it to a waiver. The service will remain the same, but we are just encouraging people to sign up. And again, I will put that information in the chat, so that way you can, if you have questions, we made the process extremely easy, and all the information's in there regarding what the waiver fee is, and I think it's $30, but we're happy to answer further questions. So that's all I had, so thank you.
Thank you. Leslie, we will pass on to you.
That is wonderful. Thank you so much, Heike. And I would like to remind you all of the different resources that we have on our division's webpage. I'm going to share my screen, so bear with me, please. Let's see. And you should be able to see my screen. On our division's website, as you can see, Station MD, you can click on that, and there's all kinds of information about it. So please don't hesitate to look into that and utilize this wonderful service. And we will definitely drop this link in the chat. I have a few other links that I'd like to remind you of. I'm sure that you're already aware, but just in case, I just want you to recognize that there are things out there that can really help you all get through this next level of the pandemic. Stronger Together. This is, of course, the Department of Health and Senior Services handy website. It's got all kinds of good information and assistance. and you click on info and you can see where you can get COVID testing, all kinds of different things, vaccinators. If someone needs to get a ride, you can click on that and get a ride for someone or yourselves. It has the facts that you can read up on and share with people. And then, of course, other vaccine information. You know, of course, now with the children can get vaccinated, and here's another link that you can click on for vaccines. Of course, the Department of Health and Senior Services main page right here. I just wanted to show you this. And if you go down, I'll show you a little button you can click on, which is kind of interesting. It's called the COVID-19 dashboard, and I already have it pulled up. And it shows COVID-19 in Missouri at a glance. And this is information for the past 7 days. So it shows vaccinations for the past 7 days in Missouri, confirmed cases, reinfections, confirmed deaths, all kinds of different things, hospitalizations, and these are COVID patients that are in the hospital. So it's just kind of interesting to see how our state's doing with this, you know, little kind of an at a glance type of a thing. I'm going to go back to the DHSS site, and we have a column over here, a right column that's on every page. And what I'd like to point out is COVID therapeutics. It used to be titled monoclonal antibodies, but not only do we have a monoclonal antibody treatment if you're symptomatic and you qualify, but we also have, which was effective yesterday, pre-exposure prophylaxis with long-acting monoclonal antibodies for a preventative for those that qualify. So don't hesitate to get on there and read up about that. Another link that I would like to show you is hotspot advisories, which I believe is very interesting. You can click on that and it shows the different counties and the different, like the dates and then the advisory, and it'll tell you about cases and how to cope with that. And you can see all the different counties in orange have been under advisory. Let's see. And then we have, of course, our link to specific division guidance, which was on the screen earlier. It's got the specific guidance for PD operations, vaccine information, information for individuals and families, and resources and videos. Those are very good if you want to educate people on that. And then the final link that I want to show you, it was created for families, caregivers, and individuals. And it's just a real easy one sheet page. You can print it off, but you've got links here to different easy to read type of things to educate yourselves and others on all kinds of aspects of COVID. And there are also videos that you can look at, and they're linked to this, but the videos are pretty neat. They kind of tell a story. And so people, if they're anxious about different aspects of the pandemic, they could watch a video about it and it could perhaps help add some comfort. And then finally, I just want you to remember to work with your local health departments. If you or your agency has had any positive cases, they are a great resource and can give you the best guidance as it relates to what all is going on in your community related to COVID transmission and then what's available to assist you locally. And that's all I have. I'm going to stop sharing. I appreciate the time to be able to speak with you all today. And I'm going to pass it over to Wendy.
Good morning, everybody. I really don't have anything necessarily to share with you. It's business is kind of usual. We are continuing the mask. I know that there was a question that came earlier about the AG's decision in Cole County. And I'm sorry, I was distracted during Dr. Stanislaus's answer there, so I didn't get to hear her answer. But, you know, our guidance is still in place. So remember, it is guidance. Remember, it is permission to work remote. And we should always follow good guidelines and safety practices when working with vulnerable individuals and in situations where we don't know the vaccination status of people. So be mindful of that. If you have other questions, please, you can email me directly if you don't have time to put them in the chat. but we have, as a reminder, our modified monitoring extended to the end of January. We got information from some of our providers and understand that this can be difficult and expensive with the data plans and all of that. And so people are getting anxious to get back to a new normal and being able to have people come out and visit, and the support coordinators come in the homes and visit with people. So we will be working with Dr. Stanislaus and our division and department leadership on making those decisions. And as promised, we will give you 30 days notice so that you have plenty of time to make any arrangements that you may need to make. Or you can start earlier, you know, once we do that. If you are working with homes or families that are comfortable with doing an in-person visit and you're comfortable with that, you may absolutely go ahead and do that. So again, if you have any questions, please send them to the DD mail, and we will get answers to you. And I apologize, I don't know who I'm passing to.
That's all right. You're passing back to me, Wendy. We do have an abbreviated agenda today. We have some folks that are out of the office. So that concludes today's webinar. I will remind you that DD mail address is ddmail@dmh.mo.gov. So as Wendy said, please feel free to submit any questions or anything that you may think of later on to that email address, and we'll make sure that it gets where it needs to be. And with that, have a wonderful rest of your Friday and a wonderful weekend. Thank you.